Thank you. I want to thank our partners from Public Health for joining us. And I'd like to offer a couple of additions to some of the questions that have been asked, and then I'm going to go into what I have prepared to share from the work group along with Mr. Manzo. So in the latest guidance from Health and Human Services, the requirements for use of face coverings and masks from June 30th, which outlines the overall requirements, but then also guidance for people, for businesses, and such. And it does say that face coverings are not a substitute for other prevention practices and should be used in addition, in bold, in addition to 6 feet apart, washing hands, and staying home when ill. And then another question was asked about how long does it take to get results. Just to give you an example, today I was notified by one of the principals that one of the staff, the custodial staff, were still out on self-isolation awaiting test results, but had reached the 14th day since contact and since self-isolation. And so without a test coming back, that person having no symptoms, they actually waited out their entire self-isolation before the test results returned. But without symptoms and without a positive test, they're able to return because of that time period. So we can see that we're likely not going to have all the answers we need when it comes to the testing and the results at the times we need them. Okay, so just to reiterate, the members of the health work group include myself, Mr. Manzo, our interim director for human resources, have 3 principals, 1 elementary, 1 middle, and the assistant principal from the high school who's also an athletic director, really trying to pull in those pieces. We brought in community partners, added teachers to our group, have HR benefits, special education staff, and of course Carla Turner, our assistant director for public health, has been an integral member of our team. We really framed around the original essential questions. I like to call them the corollary questions, as I shared to you last time. How will staffing needs and impact be identified and addressed? How will vulnerable students and staff be supported? When, how, and by whom will screening occur? These are some of the questions we're still asking. How will students and staff that exhibit symptoms at screening or during the day be supported, and by whom? So while we have a lot of unknowns, such as specific details from each staff member on their preferences and comfort level, we know that there are several steps that we can take to be ready. I also want to mention that these members of our health committee work group have been tasked with sharing and receiving input from their own peers. And many of these folks are also parents of students in the district. Specifically chose one principal that has 4 of her own children in elementary and middle schools, to really provide for us that readiness from the parent perspective, and also kind of sticking with our time constraints of working quickly, and really using this group to inform the work to seek solutions to the barriers that we found. So I'm going to start with the progress. And the progress I'm going to outline along with Mr. Manzo is toward controlling the school environment as the precautions lay out. And so we really have to be as prepared as possible. So I hope it's obvious that we have a collaborative working relationship with public health and really strong dialogue about what's actually happening and what we need to be prepared for. We have strong collaboration among our staff and other service providers within the schools, such as including Coastal Horizons, who run our day treatment center, who run our white clinics in the high schools, which are the health clinics, the Wilmington Health Access for Teens clinics, and who also provide school-based mental health in addition to our public health partners. We have created a staff screening tool and training, a paper version and a digital version, with training videos prepared through our communications team and Michael McGuire with NHCS TV on training our screeners so that they can train fellow staff and then they can also train students. We've created that to lay out understanding exposure, which would be those close contacts, diagnosis of COVID, and then also symptoms. And what if those occur among staff? What if those occur among students? And what do you do if they do? Because they're all very different. Honestly, the guidebook, the resource guide that was the last one we received on July 14th, provided 24 pages of protocols on what to do if someone has been exposed, diagnosed, or has symptoms. 24 pages of protocols. And so administrators were trained on that last Wednesday, and we're taking any questions that our principals and directors give to us to know that we have more work to do to further iron this out. And we are ready to roll out the screening of our staff. And I want to reiterate that we're ready to roll that out as soon as our staff are returning. Again, 10-month staff, much like you heard from Carla. Our school nurses are 10-month staff. They haven't returned yet. We know that we're the second largest employer in the county. We are also going to be leading the way in mass staff screening because the requirements say so, and we're going to be leading the way. The county isn't mass screening staff. I'm sure the hospital has their precautions and measures, but we're the second largest employer in the county, and we will be mass screening our staff. And we've already started with some. And we know that we just heard the numbers on the school nurses. We don't have enough school nurses to do the screening. We're going to rely on our school nurses providing strong training to our screeners. And I am confident that that's going to work well. We've also created informational videos, some for parents, just with a conversation about what we're doing with the health committee, some for screening, hand sanitizing. We've used our school nurses to work with children of our staff members who bring them in and let them be characters or actors in our videos, bus stop screening, and also other planning for opening. In addition to the progress, we've launched universal, meaning district-wide, social emotional learning to address the increased needs of all students, increased social and emotional needs of all students. We cannot forget that we are in the business of addressing overall needs. And that includes the social emotional needs of those who are most vulnerable, but also everybody who has had a lack of socialization and potentially a lack of supervision, a lack of basic needs met. So we're ready for that for pre-K through 12. We've also created remote learning labs for school-aged children of New Hanover County School staff to provide care for their students at the parent/employer's work site as an employee benefit to mitigate the need for childcare due to school calendar changes. So if we are, as soon as we're able to get to B, whether we stay on B or whether we race to B, and however, until we're at A, we are going to have childcare issues among our own employees, and we need to identify ways that we control and mitigate that. While we are not operating childcare, we can provide an employee benefit of a remote learning lab for children of our employees in the same site as the employee parent. So we have also utilized and aligned our resources from the Public Health Toolkit, the DPI guidance document. However, updates are so frequent that we're not really able to iron out plans too far because we keep getting updates on changes. And I have some information on that in our barriers list, but I want to leave that as a positive right now, as a progress, that we've utilized and aligned those. We've analyzed the essential questions down to the most discrete details in attempts to really provide the most specific information and resources for staff to accomplish this. We want to make sure that staff are confident in approaching these precautions. From the health work group, we've generated parent and staff survey questions from the perspective of health. We've worked on our end to create the administrator checklist items for school level supports by timeline. What can principals and directors be doing right now, and then next, to be prepared without wasting any time? We do have a strong supply of PPE, so personal protective equipment, and then that includes thermometers, I think our last count was 700 and some thermometers. Masks, we're somewhere around, even with some that might be emergency pull, we've got more than 150,000 in screens, face screens, and in masks that are different for more vulnerable populations needing to be clear. And then also focusing on, for those folks that might have a hearing impairment and need to additionally read lips, for those who really need to see facial expressions to understand the context of communication. And also we had to learn a little bit more about which ones don't fog up. I'm having the problem right now that my glasses continue to fog up as I continue to talk to you. So we wanted the clear ones that don't fog up, so that it's always a learning game. We've also, like I said, provided administrator training on the screening, the management of staff and students with exposure, diagnosis, symptoms, and really gleaning from them more questions that we have. We've also problem solved, although you're going to hear from me in a few minutes on the barriers. We've problem solved mask requirements by really studying and gathering every piece of information there is through CDC guidance. And then, like I said, secured appropriate masks for more vulnerable populations, whether they're clear or screens. And now I want to ask Mr. Manzo to come up and speak to you about the high-risk staff accommodations request that has been created so that we can protect our more vulnerable staff. And then also the staff survey results to give you an idea of the information we're using. And then he's going to speak to you a little bit about barriers that take from the hypothetical to the explicit protocols, and then I'll be back with more information. Thank you.
Ms. Farnham?
Yes, ma'am.
And I'm sorry, I probably should have asked this when the health officials were up there, but who's with us? First of all, the thermometers, are those distance thermometers, the 700 some you have?
Yes, so those are the infrared thermometers. So a part of the screening protocol requires that the screener keep that 6-foot distancing during the screening, except for the moment to reach in and use the thermometer at close range. I was going to do that with Mr. Manzo, but I don't think it shows in the screen. So that's the only moment in screening that you are within the 6 feet, and they are the infrared, but you have to be, I think, it might be somewhere between 2 and 6 inches from the forehead.
And also, and this is where the health department might have been helpful, who is it, if we find a child that needs to be in isolation until a parent comes, picks them up, I mean, it sounds, who will be with that child? We're talking about little kids here, and we know how that goes.
Exactly. Yes, I have, on the barriers part, once Mr. Manzo shares the staff results, I'm going to talk a little bit more about the isolation concerns and the response protocols. Yes, you are 2 steps ahead of me.
Okay.
Thank you.
All right, thank you. Good evening, everyone. Thank you for having me. What I want to do is talk a little bit about the employees and what their intent are. So a week ago yesterday, July the 20th, a staff survey went out to all the New Hanover County staff, and it was a very quick survey, and they only, once they identified who they were, where they worked, and what their position was, the only thing they had to do was answer a question, only one question at the end of the survey as to what their intent was. And what I like to qualify is that in the survey, when the survey was sent out, in the instructions, it asked people for their plans. We need to know your plans, assuming at this time, which would have been last week, there are no changes in your individual, community, or state situations. And then what they did from there is they answered a question. And what I would like to do is I'd like to go to the bottom box of the chart, and where it says there are 5 options. And if we look at option 1 would be, I plan to return or to continue to work with no requested accommodations. And if that was the choice, there was nothing else that the individual needed to do. Option 2 was, I plan to return to work and will be requesting accommodation due to identifying high risk for severe illness due to COVID-19. Number 3 was, I plan to return to continue to work and need to work remotely, though I do not qualify for a high-risk employee. Number 4 was, I do not plan to return to work and will be requesting leave. And number 5 was, I do not plan to return to work and will either resign or retire if eligible. So those were the questions. There was only one opportunity to answer a question, and so we don't have multiples. And then if we go to the middle box where it says response rate, you can see, I'll put my glasses back on, the response rate was of the 3,592, the response rate was 72.5%. And if we go back up to the top box where it says total responses, there were 2,607 responses out of 3,582. And what we did is we broke it down. If you start at the top, it'll show you certified, teacher assistant, et cetera. And if you go across the top, it'll tell you the total number of responses and which option they chose. And if you come down to the next section where it repeats certified personnel, it tells you basically there 68.47 of the respondents chose option 1 in the certified personnel. And just as an FYI, the certified personnel were all teachers as well as school counselors, psychologists, etc. There was anybody with a DPI license. And so this gives you the information as to how things shook out. Now, the survey ran until Thursday night of last week. This information was captured right after lunchtime on Friday. We kept it open so that we can get some more results and get a better response rate. And then if you scroll down a little more, Crystal, just a tad, what you will see is I asked for, of the certified personnel, there were 1,909 responses, which accounted for 86% of the certified personnel. And when it comes to transportation, which is bus drivers and bus aides, there were 198 responses, which accounts for 39.9%. So I'm sure this chart could be shared with you for further reflection, but this kind of gives you an idea as to how the numbers shook out as of just after lunchtime last Friday, the 24th. If anybody has any questions about this, I'll be happy to answer it. If not, I'll keep going. Okay? So what I'd like to do is go now to the option 2 on this survey, which is a temporary accommodation request. And let me just go back something. If they checked on they needed a temporary accommodation request because they were in the high-risk category for COVID, on the survey itself, there was a place where you can click a link, and it would take you to the form that would need it to be filled out for high-risk employees. And what it is it's a three-page report. The first 2 pages the employee filled out, and then the third page a healthcare provider would have to fill out, attesting to what was certified on the front side. This is from the CDC. This identified individuals as high-risk individuals, and then there's several bullets. People who are over 65 years of age, and then there's a lot of underlying medical conditions: chronic lung disease, serious heart condition, compromised immune, hemoglobin disorders, obesity, diabetes, chronic kidney disease, and liver disease. So if anybody was over 65 or they define themselves as a high risk due to any of these underlying conditions, they would fill out this form, get the third page filled out by their healthcare provider. It would come to Human Resources, to our benefits office, and a decision would be made. I will tell you that we're not medical people in the Human Resources Department, so we're not going to go into a deep dive. If a healthcare provider filled it out and it has the appearance of this is something that they're certifying to as far as an individual, then we were going to take it on face value. We're not going to go behind the scenes to try to validate the healthcare provider or whether or not the individual had these issues. The only one we would be able to see would be obviously the 65 or older. The other part of the survey, if a person chose option 5, which would be to either resign or to retire if they were eligible. There was a link next to that option, and it clicked to a resignation retirement form. If they straight out resigned, that would be processed as such, and if it was something that was a resignation with retirement for retirement purposes, then that would be processed through human resources for the individual to retire. So what I'd like to talk about now is to talk about, our committee has met several times. The last time we met was Friday morning for about an hour and 40 minutes, and we really covered a lot of ground. And I can tell you, I'm not from New Hanover County, but I can tell you having the vast knowledge base of individuals that were on the committee was a huge help and a huge insight for me, because it showed people that were not in the school system and the issues that they themselves were grappling with regarding this virus. So as you probably figured out already, some of all of the presentations had two parts to it. There was the progress of the team, and then there were the barriers that the team ran into. So some of our barriers were concern with readiness. You heard the health people that just left. Their nursing capability is not up to par. They don't have a full staff. I believe they said they were 6 people short. When they do attain full staff, they will have about 41 nurses. So I'm not going to belabor that point. I will tell you that their nurses that they do have are, they're not 12-month employees. So these folks haven't even returned to work yet to begin training as to how to be the liaison for the school and basically be the point person, the medical point person for school employees when it comes to the myriad of issues that would occur during the course of the school day, not for just students, but for staff as well. There is vacancies like we talked about. I will tell you that with regard to New Hanover schools, as of today, as of 2:30, I did ask for how many certified people we still had open. As of this afternoon, there are 29 vacancies of certified staff, 7 elementary, 7 middle, 4 high school, 7 exceptional child, and 4 others, including dance, AIG, and 2 social workers. Most of the vacancies are due to growth, except for exceptional children, and within the past 2 weeks, there have been 8 resignations from the school system. So some of our other barriers were the school nurse coverage at all the schools. Even when they are at capacity for their staff, they're not going to be able to cover all the schools. Staff anxiety regarding the timeline and training for 10-month staff. So we've had a lot of people, New Hanover County employees that have not worked over the summer. They're 10-month employees or 10.5-month employees. I will tell you, there's been a lot of calls that have come into the benefit office about, I don't feel good about returning to work. I'm concerned about returning to work. I'm very scared about returning to work. And so those are things that we are working with, talking to individuals, and what they want to know is what their options are, okay? And so their options, if you have such a desire, I can go through what some of their options are if someone were to opt out and not return to work, either face-to-face or virtually. I can give you a rundown on how that works. Some of the other barriers we've run into is conflicting guidance between DPI, Health and Human Services, and CDC. Just last week, what they did is they changed the language on their high-risk accommodation form. Now they're calling it increased risk. One of the things they did is they changed the BMI. So the BMI is your body mass index, and it was at 40. So if you had a BMI of over 40, that would qualify you as high risk. They've now dropped it to 30. So that's going to include a whole bunch of other people, and you can go on the internet and put in your weight and your height and your sex, and it'll tell you what your BMI should be. They're not really very liberal in their application of that. I mean, they want people to be very, very thin and fit. Another thing they've changed is the isolation period. If someone has any of the symptoms or has been diagnosed, from 14 days down to 10 days, and answering questions when an individual comes back to school, because there is a screening questionnaire. They changed the 72 hours without a fever, without medication, to 24 hours without a fever, without medication. So these are some of the things that our health committee has been working on. Been a lot of progress. There's also been, with the progress, a lot more questions that have come out, and has caused us to run into some barriers and basically some things that we haven't been able to answer. So that's my part of the presentation. Now I'll turn it back to Ms. Varner.
Mr. Manso?
Yes?
In this survey, and it looks like it's about 72% of the people responded, or 73, you have pretty cut and dry questions, and there's really no question on there except you want to come back or not come back. You didn't have anything that says I want to come back but with reservations, and yet you're receiving these phone calls, I guess, that say there are people that are having reservations. That's one of the reasons they're calling you and asking you those questions. Would you say that's true?
So a lot of the people that have called with questions would have picked option 3. They would like to return or continue to return. However, they would like to work remotely, even though they don't qualify as a high-risk employee. And that would have been the best option for somebody in that position. They want to come back to work. They don't want to work face-to-face. They're telling you they want to work remotely. And they're also telling you they don't qualify for any kind of a high-risk accommodation. Okay, thank you.
So just to continue on with a few of the pieces of conflicting guidance among DPI, DHHS, and CDC. And for those who aren't in the world of acronyms, thank you, Ms. Justice, for reminding us of that. Department of Public Instruction is DPI. DHHS is the North Carolina Department of Health and Human Services, and of course the CDC, the Centers for Disease Control. So some of the other concerns are what Ms. Stagner mentioned a little earlier about competing rights and competing requirements, especially around mask wearing. So we are still trying to figure out what the exemptions look like. How will we know who is exempt? Early information shows that we cannot request documentation. Public Health and I talked last week, and Ms. Stagner and I and many of us have been in emails with each other on, while the school recommendations are K-12, we all wear masks, 100% wear masks, 100% of the time. We also know that in the Health and Human Services guidance, 11 and under is still listed as an exemption. Although, legal guidance will tell us, well, that doesn't really apply to the K-12 toolkit. But we also see that this exemption can be requested by the parent, without documentation. Executive Order 147 from the governor says that North Carolinians will be on an honor system regarding mask wearing. And so then we have to have the questions of, with an exemption, whether we have that documented or not, do students then require remote instruction? And as Ms. Stagner pointed out, that's still being analyzed. And if they don't require remote instruction, how are we protecting others? The other is, with exemption, you've heard Mr. Anderson speak to bus capacities being lessened. So also on page 5 of the Public Health Toolkit that was updated two Tuesdays ago, the 14th of July, in line with the governor's announcement, on the same page, page 5, it is required that all students, K-12, and staff and visitors wear their masks 100% of the time. It is recommended, again, not required, required at 100%. They recommend giving breaks, but you're required at 100%. There's some opposite logic there that's really difficult to maneuver. So we're working through those. Also, how do we ensure proof of, how do we ensure all the folks have been screened? Do we have some type of identifier? Do we have 30,000 red stickers for today and 30,000 blue stickers for tomorrow and then green? Or do we operate on At the beginning of the day, we do screening, and then if folks come in the building that are not staff, we screen. We also need to focus on time for instruction to our students on proper mask wearing. We heard that from our public health staff. Proper mask wearing. For many of us who have been in school settings for a moment or for years, when there is an expectation of kids, they will find all kinds of ways to demonstrate how it is and isn't supposed to be done. And there are some pretty comical videos out on YouTube on how all the ways that kids can wear masks, all the ways, and all the things they can put in them and all the ways that they might not be appropriate or might not actually be helpful. We need to support them with instruction on how to wear the mask properly, on mask hygiene. If I take my mask off and lay it face down on this booth where many people, or podium, where many people have been walking or talking and sharing and presenting, and I rub it on here, I mean, I'm gonna then have counterproductive interactions from my mask. We also need to teach our students of physical distancing in all spaces and including in transitions. Our kids are expecting to return and embrace one another and crowd together. Kids don't maintain 6 feet. These things are not natural to how we have operated and to how we've operated ever in schools. And I think Mr. Anderson said it well. You know, Plan B is difficult. We want Plan B because we really want Plan A. Plan B is difficult because it's not been done. So I do think it's doable. I do think we have to put some pieces in place. So again, that need for instruction. We know that comes after the training of our staff to be competent and confident. We also know that we can't really over-rely on testing because there are false positives. We also know we can't over-rely on the infrared thermometers because if somebody's been standing outside in the heat and we screen them before coming in the building, their temperature is higher than if we wait 20 minutes in air conditioning and then rescreen. How do we manage that? Do we turn kids away who are just hot? You know, who've been riding the bus with the windows down so we've got good airflow, but then we immediately screen and their temperature is high, but they actually don't have a fever. So being able to, again, not being medical staff, being able to discern and adapt all of this information to decide what happens right now for a student, it's pretty monumental. With student screening, we need to make sure that we identify protocols for confidential screening prior to entering the building. If I just say that part, it makes sense. But we cannot compromise safety measures. We need the 6-foot distancing. We can't compromise FERPA by asking a child if they've potentially been diagnosed with something that is nobody else's business because it's confidential medical information. Also, without creating long lines, whether it's car lines that just wrap around the building because we're trying to screen before kids get out of the car, because it doesn't make sense to screen them after they get out of the car and they don't screen well and they potentially have symptoms or a fever and we call the parent to circle back through. That doesn't make sense either. But do we have car lines that are 45 minutes long? We have to screen, but we know we have to do that quickly, and our facilities and our property doesn't always allow for multiple car lines. That doesn't really happen. So we also don't want to pull kids out and have them waiting in mass outside the building. So do we make a place inside the building where we, rope in and out of cafeteria tables to maintain distancing, but to get through the screening? How do we do this without delaying our instructional time as well? I think it can be done. I think we need to make sure that our staff are ready and are able to very quickly and efficiently with confidence screen kids through and bring them into the classroom environment where we can get the teaching and learning to happen. We've also got to consider our processes for emergency drills. We need to be prepared that if there's fire drill, tornado drill, any of these type of events, we have to make sure that our students don't compromise their health with regard to COVID-19, but also make sure that we're following safety precautions. Management of our vulnerable student populations is another big barrier. We have medically fragile students, And service delivery for those with the most up-to-date precautions are really complicated because not every child's physician agrees on whether they need remote or more face-to-face. And then knowing that many of our vulnerable populations require staff to operate inside of that 6 feet, and really supporting them with some daily self-care that involves feeding, toileting, and other immediate needs regarding behavior or developmental concerns. And in that, where distancing is not feasible, exposures will happen. We don't have a way around that because of how this is. I also want to mention that Trillium, our local management entity for mental health, is still not allowing congregate services such as day treatment services. So we could potentially be trying to bring in our most vulnerable students with regard to mental health without having that service available to them that's a part of their placement. The last thing I'm going to mention is the isolation and the response protocols that we need to have in place for folks who have been diagnosed, who have been exposed with a close contact, or who are symptomatic. It's one thing if it's staff, and we can say, okay, we need you to go home, follow up with your healthcare provider. We're reporting this to the school nurse. And the school nurse is our public health authority, which is required in our toolkit requirements, or our toolkit guidance. And they need to be prepared. So we need to be ready to handle the staff situations and then have backups to support the students in the building. But we also really need to be ready to handle our student isolations when they are not in the presence of their parent or caregiver. A kid develops symptoms throughout the day, develops a fever throughout the day, or the parent calls and says, I can't get there, but I'm just telling you right now, my sister who lives with us has tested positive. We have to make sure that we have one-to-one isolation areas per the requirements. Not one large space where everybody that's not well is and provide them supervision until we get them home safely or with their parent or caregiver. We have to have one-to-one. Now, typically in the beginning of a school year, and especially in elementary schools, kids aren't necessarily saying they don't feel well, but somehow symptoms can project or can appear throughout the school day. We have kids that are sick all the time in school. But this is a different scenario because of the heightened alertness and the heightened concern, rightfully so, of these types of symptoms, and making sure that we don't have sick kids together. They're all one-to-one with a staff member with them, supervising and providing them care. So basically, in a nutshell, staff working with our students need to have the opportunity to successfully manage the health precautions as outlined. They need to be able to be trained, and they need to be able to teach their kids to be ready for this. And we're hopeful that this will occur with the training time for staff, the instruction time for students, and the confidence that both staff and students, along with families, have that we're ready for that. And I think the major piece is having our staff available for that training. I know that was a lot of information. What questions can I answer?
Well, this might be from Mr. Manzo. I forgot or didn't think about, what about the TAs, teachers assistants? Because they're vital to so much of what we do, from the EC kids to regular classrooms. How are we down in numbers with that? I didn't ask him about that.
Are we down in TA numbers? Vacancies?
Vacancies. So, yeah, I guess I should have been a little clearer.
Right, staff vacancies for teacher assistants, right?
Correct, yes.
Okay. Are we
So
down in
I don't have that right now. The information I requested this afternoon was specifically for certified people. That's easy to get. I can have that quickly, but as of right now, it's just the numbers I gave you was certified staff.
The teachers assistants are so valuable in so many, especially the younger classes and the EC classes. That's why I was asking. Thank you.
Okay.
If you could get it to us as soon as possible, maybe, I'm not sure when you can.
I can get it for you, yeah, sure.
Like that. And also, Ms. Varnum, you said that there's a lot of information you were giving. So when a child is isolated, they need to have an adult staff member with them in an isolation area. Is that correct? Is that what you were saying?
Yes. Each child has to be in a separated isolation area, and they have to have staff supervising them. One child and at least one staff member supervising.
So if you have 3 or 4 kids, say you've got 200 kids at school, and you have maybe 3 or 4 kids that are showing symptoms of something or the other, I mean, there's a lot of broad symptoms here, you can really tie up a lot of people being with those children. And they're supposed to maintain the 6 feet too, wherever they are?
Absolutely. We have to make sure that it's in a space where they can maintain the 6-foot distancing. And right now, we're not able to project the numbers of isolation spaces we may need to support the number of children who may come to us symptomatic.
A child who's got a stomach problem, and they're also upchucking, so you have to be close to them to maybe cover some,
Absolutely.
yeah, that would be,
Absolutely.
yeah, okay. Thank you very much.
Is that for any symptom, or are you looking for specific symptoms?
It's for the main 5 symptoms of fever, chills, loss of taste or smell, respiratory, I'm missing one. It's for those main 5, but the majority of illness, especially as we heard from public health, allergies and respiratory conditions are much more common as we come together.
But even something like, conjunctivitis manifests in 3 to 5% of COVID-19 patients, and that's predominantly higher in younger COVID-19 patients because it's a mild symptom. I mean, and that is everywhere in school in a normal year. Would that require isolation?
Well, because we aren't going to be able to tease that out. We can't say, well, we know, typically 3% of our kids every day have symptoms that are concerning, but if those are the same kind of symptoms that correspond with COVID-19, we aren't going to tease that out, and we have to assume if they are in those major symptoms, yes. Because, other sicknesses don't go away because we're in the pandemic. It's a good point.
That could be a very large number of.
It could be, and we would love to be able to project the number of isolation areas that we might need, but it's an absolute guess at the moment. It's an absolute guess. I think that if we have a strong confidence level of our staff screeners and our staff who are seeing symptoms and who also have an opportunity to know their students and students being prepared and families being prepared, through their child's instruction, I think that we can see, with that confidence level, we can see less need for that.
Thank you.
I have one question. Ms. Farnham,
Yes.
what, you've talked a lot about COVID, and I appreciate that. Everyone's talked about COVID, but they haven't mentioned the issues that kids may have if they're not in school, and weighing those benefits or those risks of kids not developing socially, not being educated, weighing those risks versus COVID. Have y'all, no one's even mentioned that. Has anyone had any discussion about that, or is this simply about COVID and not worried about any of the other issues that our children are going to have not being in school?
No, I think you're exactly right. Several discussions among the health committee have not been, well, first of all, our overall goal of the health committee, and I shared this at our last meeting, but I probably should have started with the goal tonight as well, is to support the overall health and well-being of children, adolescents, families in our community. And number one, to focus on the overall health and well-being, we can't isolate one area over another unless one has a greater risk. And I have to, while I am, student support all the way and really want to focus on the social emotional learning, I also realize that we're talking about, hierarchy of needs here. And when our public health staff tell us that we really aren't quite prepared, then my question is just like your questions, how soon can we be prepared? Because we might be providing safety from or minimizing risk from COVID-19, but we know that there is a cost. There's a cost to, and not talking about anything beyond our student population, there's a cost to socialization, social emotional learning. There's a cost to not having a structured environment every day and face-to-face learning. There's definitely a cost. And I have, even 2 weeks ago when I was asked to work with communications on just giving a 30-minute video update of what the health committee or work group has been focused on, I spent a good amount of time talking about that we have to make sure we do this right, because we can't open and close and open and close. We need to be able to bring our students in so that they can count on us being ready and prepared to keep them safe from an illness such as this that really is dangerous, and also so we can provide for their other very essential basic needs, which would be the socialization, the structure, the supervision. There are so many layers to the overall health and well-being, and I appreciate you mentioning that.
So also to follow up, I mean, kids will come to school and at all times there will be all kinds of ailments. It might be a fever, it might be they feel warm, their stomach might hurt. There could be a whole bunch of things that may not be COVID. And if there's a nurse available, the nurse could take it another level to sort of tease it out and see if it is the COVID. But in the absence of that, or on the advice of the nurse, because of the contagiousness of the virus, I think you have to treat it as it is and isolate them, because it is so contagious. You don't want to have them sit in a medical ward or sick room at the school where other kids are coming and going. So you're going to default back to treating them in an isolation manner until it can be disproven that it is not the virus.
There's a couple questions I want to ask, and I'm not sure exactly who to ask it for, because I think one of them is probably for Dr. Smith, and the other one I'm just not sure who to ask. For example, who is it that's going to be, say, on those buses? Is that more likely to be teachers' assistants? You're saying you're picking somebody from the school to be on the buses to help as the kids enter and exit, and then later in the day they go back, I guess, assumed to a classroom. Would that be teachers' assistants?
Yeah, so I think Mr. Anderson is going to share. Go ahead. I think that sounds good.
Yes, ma'am. It could be. It could be teachers' assistants or other classified staff at the school.
But that's going to leave a shortage then at the school for all this other entrance, I guess you could say entrance and exit of students in the morning.
You're exactly right.
Okay. And can I hate to keep popping back and forth with questions for different people, but Dr. Smith, maybe you can answer this question. This is very concerning to me, and I've had a number of teachers ask me. Teachers are to be there during the day and teach, and I've sort of figured this out in my head how you might be doing it, but then there will be a certain number of students because you've only got, say, we do Plan B. You've got a third of the kids there, and so you've got the other two that are doing two-thirds of the class doing remote. And then you're going to also have parents in the evening that can't help during the day. That's going to be, I guess, they were going to be the assistants with their kids. So the teachers are, possibly going to be on call for all times of odd times during the day to try to fulfill the requirements of covering both the virtual, the parents not able to help the kids with the work with the virtual, and then also the regular classes. Now, I know you're probably going to try to split that up because it's just practical with other teachers, but is this a possibility to work well at this point? It's so with such short, I guess, organization?
So thank you for your question, and I think the question that you've asked is one that is of concern to many folks, to both our staff and our parents. What we would envision would be that teachers would set very clear expectations around their availability, but they would also build into their remote learning systems that would be available to parents regardless of the time of day that they're working to support their children, that would be resources for them. So a teacher pre-recording a video that outlines how a task should be completed or how a problem might be solved. So, lessons that the teacher might have delivered to a face-to-face group of children might be used with a different group of children in their remote learning. So we could have a library of resources that way, but we also understand that at home we're working with many parents who are not educators, so we would need to organize that in a way that easily understood, it's very intuitive, and it's easily accessible. And so therein the need and rationale for the standardization around the learning management systems. Now, in the virtual academies, what I would offer to you by design, it is self-paced. So there would be assignments that would be made, there would be lessons that would be available to students and presented to students, but then there would be a window in which those expectations would be filled. And within those windows, I would say that there would be multiple opportunities for the parent to receive support from that classroom teacher.
Talking about an awful lot of organization.
Yes,
Putting
ma'am.
together something that has never been done before on this level and have it efficient and effective. And also at this point, you're not even sure about who will be doing what in the professional development that goes with it, or even the platform. So this is an awful lot to try to get together, talking about the August the 17th date. I'm just reflecting on that and thinking that this is just very difficult. That's the cop's observation that I'm making.
And I don't disagree with you. I would say it is not only complicated, but it is also complex.
But Dr. Smith, y'all have been working on this since May, correct?
So we have, excuse me, we have been working and actually designing professional development and engaging in conversations around learning management systems actually prior to May. We knew that there was a possibility that we would continue to find ourselves in a situation that required those resources. So even though those conversations, that planning, those things that have been taking place for a long period of time, bringing them to fruition, bringing them to the point of execution still has been very, very challenging. You know, we have done our best in consulting with other districts across the region. As you know, New Hanover County is a part of the large district consortium, so I work with and consult with other chief academic officers across the state. We have other groups for the large district consortium that work with our folks in operations. So we've worked on this very, very collaboratively, and I think it doesn't matter who you ask across the state, they will share with you very similar responses in that this has been very complex and very complicated. We want to get it right. We want to do it the best that we can. And so, you know, in looking for the opportunity to do it better, that is where we are right now as a district. It is just too important for our children and for our families and for our teachers to get it wrong when we have the opportunity to do the very best job at it that we can.
You keep saying that, but do the best job that you can. But with all due respect, Dr. Smith, our teachers know how to teach. We have great teachers in our school. When they're doing face-to-face, they're doing a great job. The barriers that I see are teaching the kids how to wear masks and being 6 feet apart. I understand the virtual part is something new for you, but if we give the parents a choice and allow parents to send their students back, you don't have to train 100% of your teachers. You only have to train half of the teachers or whoever choose. So I guess I keep coming back and I'm confused why you keep saying we want to do the best job. If we're doing face-to-face, we are doing the best job. I don't think anyone doubts that. I understand there's another aspect to this, and that's the virtual aspect of this. But we don't have to train 100% of our teachers in the virtual aspect. We just have to train enough teachers that will be able to accommodate and provide a great education for those virtual. So I don't know why we're trying to do 100% of the teachers in virtual training. And that's where I'm confused.
So I very much agree with you, Mr. Wortman, in that we do have incredible teachers in our district, and they have done an incredible job and do an incredible job with the face-to-face teaching. And I very much agree that our teachers put forth a great effort to meet the needs of our students when we experience emergency school closure. What I would offer is in training all teachers across the district that even if a teacher is presenting in face-to-face, they are collaborating with the teacher who is responsible for another child's remote learning. So one does not happen completely independent of the other. Also, I believe very strongly there is the need for us to be flexible, because even if we open in Plan B, that does not mean that we won't at some point transition to Plan C. Whereas if we open in Plan C, that doesn't necessarily mean that we won't transition very quickly back to Plan B. So again, we want to be as prepared as we can, but regardless of where we land, I have every confidence in the administrators and the teachers and the staff of New Hanover County School that they'll do the very best job that they can for the children and the families of this district.
And again, I understand, I appreciate your response. I would offer that if we do delay schools for 9 weeks, at that point, it really is tough to come back before 9 weeks. That's why I think it's important that we know exactly how quickly we can get face-to-face learning. And that's why I've been asking those questions, and why we've been planning for 3, 4, even more months than that to get our kids back into school. And that's why I'm a little perplexed as to why the reason why we are delaying school is because, as Dr. Burns said, we are not ready. And that's where I'm a little confused at. And I understand it's a monumental task.
I would point out that Wake and Mecklenburg and
I'm not,
Guilford.
listen, with all due respect, Wake has over 2 million people, Mecklenburg has over 2 million people. We're
the
not.
largest district in the state. We're not the only people who aren't
We're in
ready.
Hanover County, we
Brunswick
have
County's not ready either.
220,000 residents, and our residents have spoken up and said that they want to be, a majority to be back in school. I'm not asking to open schools up to all kids. What I'm saying is we don't have the right to make a decision for the families. We have an absolute obligation to give our community and our parents and our students the choice. And we've taken away that choice numerous times this summer. It's time to give them a choice.
And if you go to a restaurant and you sit down and order a steak, and they don't have steak, the person ordering it didn't get a choice taken away. Logistically, those services can be provided. You have one of the top educational men in the state sitting here to my left. You have an incredible team telling you, logistically, we are not ready to do this.
Nelson, I understand you're going to do whatever Dr. Burns tells you to. But,
No, I'm not.
But what I'm trying
going
to
to do
tell
whatever
you
my
is
conscience tells me
people-
to, and I'm going to listen to people
want
who
a
know more than
choice.
I do.
You've taken away the choice multiple times this summer. They want a choice. You have the opportunity to give them a choice. Face-to-face learning or virtual learning. That's what plenty of school districts around the country are going to. That's what they want.
It's not an issue of choice. It is an issue of possibility, practicality, and logistics.
Absolutely an issue of choice. It's absolutely an issue of choice.
And you can't tell me
Unless
that
our
parents
schools
were
are
consulted when 10 minutes
I
ago
don't
you said
believe it
parents
is.
weren't consulted.
Excuse me?
10 minutes ago, you said parents weren't consulted, and that was really disappointing, and now you're telling me what parents want.
Parents were, I don't know if it was intentional, but they were kept off the committee, which I absolutely disagree with. I don't know why. Many
Mr.
parents
Wortman,
have
you just
also
heard
developed-
Miss Askew tell you that there was a principal on there with 4 children who actually were, she has 4 children in the district. I believe that makes her a parent.
Lisa, parents were kept off. The survey that was given to the parents, we made a decision on Plan B before the results came out. That survey was so confusing, I think we would all agree. Parents have not been consulted in this process. I think with our emails that we've gotten, it's very clear that parents feel one of 2 ways. They want Plan C or they want face-to-face. I know as a school system, with our administrators, with our teachers, with our principals, we have the ability to give them that choice. I'm asking to give them that choice.
And we are the elected leaders that are trying to make that decision. Mr. Manzo, do you have something that you need to add?
I just have a follow-up. Ms. Justice had asked about the number of teacher assistant openings as of today, and the information is, as of right now, there are 7 special ed teacher assistant vacancies and 4 regular ed teacher assistant vacancies.
Thank you.
So our EC department sounds like it's really understaffed, for lack of a better word.
Yes, I will just reiterate that with the teacher assistant vacancies of 7 within special education, and I think we decided that we had 8 otherwise, well, 4 other for regular, But I think regarding special ed teachers, I think the vacancies were 8
9.
that Mr. Manzo has. So, those are concerns. In addition, those are those going to be the primary staff. We still have needs within psychologists and speech language and occupational therapy. So it's really about that well-rounded approach and making sure that all staff are in place. But yes, you're correct.
Thank you very much. That's very concerning. That's a huge chunk of the instructional staff for our neediest students.
Right. And percentage-wise or ratio-wise, it's there. We have a lot of special ed staff. I don't want to try to go off of numbers from a year ago, but it certainly is concerning, and honestly, very concerning that among 41 school nurses, we have 6 vacancies.
That's correct.
Double those up, and it really seems overwhelming.
We are the elected officials. We were put in this position to make these decisions. There are choices, but these are our choices, and a lot of it has to do with safety and health, which is actually the #1 priority. Everybody would love to have the kids back, but we've got to be practical here. And I would like to say something too about the amount of time we've had to plan for this. Most teachers are 10-month salaried positions. It takes a lot of professional development and organization to get them back in the classroom under normal circumstances. These are very different circumstances, and a lot of different things need to be put in place. And if you've got a 10-month employee, they haven't had 2 months to do that. They're going to jump back into it next week, but they haven't had the real time. Although I don't doubt a lot of them have been taking their own time, personal time, to try to get into this position. But still, in all practicality, we've had a big chunk of people that haven't been able to really prepare yet.
Well, and I want to go ahead and say something. I'm sure I'm going to just make everybody the happiest people in the world, but the teachers, as soon as they can get back in the classroom, if we vote for virtual, they need to be they need to be teaching from their classroom virtual. It doesn't need to be from their house. And get their rooms ready, because I don't want to last 9 weeks. I want to get the kids back in class in 5 or 6 weeks. I don't want to go 9 weeks. I don't know what y'all think, but I'm not going 9 weeks. I want the kids back in class.
But I would like that. Under normal circumstances, that would not be an issue.
Board members,
and it'll have everything to do with circumstances. I agree with you, Judy.
Board members, we still have
I agree with you in a way, Bill, that's for sure. We both wish they could be back in class.
Board members, we still have 2 groups to hear from. So
Let's hurry up and hear.
Yep. Can we still have communications and finance to hear from? So
Yes, Madam Chair and board members, I'll ask Ms. Gibson to speak to the communications work group and to be thorough but be brief, given the hour, followed by Mary Hazel Small, same thing for finance. So Ms. Gibson, if you could please share an update from the communications work group.
Thank you, Dr. Burns. Good evening, Madam Chair and members of the board. Thank you for the opportunity to share our communications progress and challenges related to school opening. I'll try to be brief. The communications division drafted a school opening plan around our communication strategies in May and early June. We finalized the details during that first week of June when the 2 state guiding documents were released. Our goals in developing and implementing the plan have included providing detailed information in the clearest and most simplified format possible. We realize it's very complex information for our community to understand, building transparency and understanding of all learning options and services available under each plan, educating staff, students, and families regarding health and safety protocols under each plan, opening channels for 2-way dialogue and community input, and reaching all families, including non-English speaking families and vulnerable populations. The Communications Division met with the Family Communications Committee and incorporated the committee's input and guidance into our efforts. And we've been communicating with their stakeholders, the employees and families, community organizations, and media outlets through the website, press releases and statements, FAQs, surveys, Connect 5 calls and emails, social media and podcasts. We've worked with printing services to supply schools with printed documents for our families without internet access. And we've also increased our translation services. So our Spanish translation support can translate our communications more quickly. And we're also expanding our translation to include video as well as print and electronic communications. We established call-in support lines for both English and Spanish-speaking families needing assistance in completing surveys, particularly those families, again, without internet access. As other work groups have mentioned, we've produced NHCS TV programming, health education, and staff training videos, and we're working on a What to Expect video series for students returning to schools under Plan B. Some of the challenges that we have encountered in implementing our school opening communications plan has been primarily related to the compressed timeline. With a communications effort this complex, it's basically been 8 weeks from the receipt of the state guiding documents to the August 4th opening for our year-round and non-traditional schools. And to include content development, communications planning, and implementation all within that period is a very tight time frame. And it's really equivalent to, or perhaps even greater than, a communications effort we might put out around redistricting or school bond program. So typically that might be 12 to 16 weeks with the content developed and thought through before we launch our communications efforts. So the compressed timeline hasn't allowed for a great deal of public input through events like panel discussions and town hall meetings. It has also created a need for parent decisions before all of the details of the school opening plans are clarified and clearly understood. Another challenge that the other work groups have mentioned is the issue that the federal and state guidance continues to be updated. So at times that requires us to retract statements and distribute corrected information. For instance, last week we filmed 2 health education videos that we're going to have to edit and reshoot portions based on revised documents that we've received. So those have been some of the challenges that we've encountered. We're continuing to build our Plan B communications and keep those dialogue channels open with our community and our families. Moving to the last item that I have to cover, we have a survey that we distributed to families, and it's currently still available on school websites in English and in Spanish. While the district's first survey indicated gross trends related to school opening, the second survey is designed to collect information specifically to individual students and schools for district planning purposes under Plan B. The surveys are still posted, and the survey of July 24th deadline has been extended to allow schools to contact families that have not yet participated. Questions are related to topics like remote learning, in-person learning, transportation, availability of electronic devices, and meal service. And again, very specific regarding family decisions regarding their students. And the results to date are going to be posted on the district website, and I will share them here with you tonight. I'll share my screen. Bear with me for just 1 minute. Schools have received over 13,050 responses as of July 24th, and the responses are evenly distributed across all grades K through 8. Response levels are slightly lower in grades 10 through 12. On the surveys, parents are identifying students by name and, when available, by their PowerSchool number. In response to the question, how will your student participate in school for the 2021 school year, 66.8% chose in person, 31.4% chose remote, and 1.9% indicated will not return. When asked, do you have high-speed internet in your home to access online learning, 96.4% responded yes. 496 respondents responded no. Their student does not have access to high-speed internet in their home. Asked, do you have a device other than a cell phone for your student to use to complete assignments online and or attend virtual learning opportunities? 77.4% responded yes. 22.6% of parents responded no, their student does not have access to a device other than a cell phone. When asked, will you be participating in the curbside grab-and-go meal program during the 2-week remote learning period? 82.7% responded no. 17.3% of parents responded that their student would be participating. And the final question, asked, will your student need bus transportation? 62.5% of parents responded that they would drop their child at school. 7.4% of parents responded that their child would walk or ride their bike to school, and 30.1% or 3,659 parents responded that their student will need transportation in the morning, afternoon, or both. And at this time, I would be glad to take any questions.
Yes, about the survey, and I might have missed it because we've got so much information coming at us right now. Were there any protocols in place to keep people from doing multiple surveys? One of the things that I heard, not heard, I was told early on, and I think I relayed that to the school administrators, were that people were multiply filling out the survey, more than one person, and so that the results were skewed. I'm just trying to see if that had been cleared up or if that was a factor.
Absolutely, yes. The first survey, there was no mechanism in place to control that, and we were aware that that possibly did skew the data. This survey is very specific. Parents list, they identify themselves by name, their student by name, and when available, the student's PowerSchool number. So, and these results are going to the schools and then being compiled district-wide. So duplicates are sorted, and the goal is one survey per student.
Can I ask, I'm trying to get this just generalized, how many people overall, not just a different specific age group, I mean, groups, overall of our 26,000 student population, and I know that some parents have multiple students, but how many participated in the survey overall?
In this current survey, we have about half of the student population participating as of Friday.
So that was
I'm sorry, that's the reason that we're keeping it open, and schools are reaching out to individual families.
So that's less, right, so far it's less than 50%.
That's
and correct. I know that principals that's part of what they're doing right now, is contacting parents, trying to spread a lot of information, including having filled out the survey. Is that where you got that figure?
The total was the number of surveys that have been submitted. Okay. But yeah, that's where we got the total number of surveys, the 13,050.
Okay, thank you very much.
Yes.
If there are no other questions for Ms. Gibson, Ms. Small, if you could give an update from the finance work group, please.
Certainly. Good evening, everyone. I just wanted to give a brief update on where we are with the budget as it relates to our response since your last meeting. And to date, the state has allotted $9.2 million in federal relief funds. The direct CARES funding of $6.1 million, which will be available this year and next year, along with $3.1 million in coronavirus relief grants, which are only going to be available through December of this year. And those are for specific things such as summer learning, child nutrition, supplemental funding, staff and student computers, mental health, and learning management systems. With each passing day, we identify some additional items that impact our budget plans. 2 examples from this week include notification from the Department of Public Instruction that the State Technology Fund had been reallotted for the School Business Modernization Project, which, because we're part of that, I was happy about. But the bad news is that meant all the direct allotments to schools, and we had $300,000 budgeted for part of our computer replacements from that fund, will not be received directly by the district. So that's an issue we'll have to deal with. In addition, $400,000 and local funds are going to be needed to activate the Wi-Fi hotspots that Ms. Brinson referred to earlier. And even though we have the state funding for the devices, we're not allowed to use any of that funding for these services. So we're going to have to look at a fund balance appropriation for that. So it is my plan to bring an amendment to you at your next meeting to sort of finalize our plans for how we're going to spend the state and federal funds. Although quite a bit of it's already been spent because part of it was budgeted in June. But we are going to, I'm going to recommend a fund balance appropriation. We're still estimating that number at this point. We're doing accruals and closing out our year. But right now it looks like we'll have $1 to $2 million that we can use for some of these additional needs. And I'll have a much more exact number for you next month. But we have recovered most of our the money we spent during in response to Hurricane Florence. We've recovered our fund balance. We're still awaiting some additional FEMA reimbursements, much of that which will sort of reimburse the state for their help during during Florence. So fund balance is in good shape. We don't want to spend it all because we have to prepare for the next hurricane, but I think we'll have $1 million or $2 million that can help us with some of these additional issues. I'd be glad to answer any questions you have. Mr. Rodenbach, I think you're on mute.
All the money that you can collect and put it in the fund balance, we're going to need, because it looks like it's going to be an incredible hurricane season.
This is true. I hope not.
Thank you, Mary Hazel, for all you do. You're incredible.
Thank you. Appreciate that.
You're welcome.
And you again, everybody's presenting so much information. How much again was that the cost of the Wi-Fi hotspots?
Just right at $400,000. Not for the. Okay. That's for the service we have already purchased the hotspots, but this is for the service.
Okay, thank you.
If there are no further questions, Madam Chair, members of the board, that concludes the update on the opening of school for this year.
All right. Thank you, everyone, for all the information. Thank you, board members, for the questions and the discussion. So at this time, you've heard the recommendation of the superintendent. Is there a motion to approve the recommendation?
Move to approve the recommendation. Mr. Boyer?
There's a motion for Mr. Boyer. Is there a second?
Second. Our motion to second.
Who is the second?
Judy Justice.
There's a motion and a second. Any discussion?
Yeah, I would like to say, I'm disappointed kind of in this whole process. when we moved to Plan B several weeks ago, one of the main things that I heard from parents in our community was they didn't understand what Plan B actually was. They were looking forward to getting their kids back in school, the opportunity to get the kids back in school, or the opportunity for virtual learning. The fact that I found out about this, that they were going from a friend who text messaged me, and then on Facebook, I think we found out a couple minutes via email that this recommendation was going to go forward. But our job is not to make decisions for families, despite what Nelson said. Our job is actually to do what's best for our kids, to listen to our community, and give them choices. And it's very clear from the surveys that were presented tonight that our community wants the option of either sending their kids to school face-to-face or remote learning. I think we would all agree that face-to-face is better for kids than remote learning, even though I asked that question several times. I'm of the opinion that face-to-face is better for most kids. For some kids, absolutely, virtual learning in the virtual academy is best for them. And parents can make that decision for their own kids. By postponing this or by closing face-to-face instruction for 9 weeks, we're not doing good for our kids. You know, there's a lot of things that we have to consider, not just COVID, but it's educational. It's, you know, you have a kindergartner or a first grader who their attention span is 5 minutes, and they can't stare at a computer like a high school student can stare at a computer for, you know, for hours at a time. And then we're asking our parents to teach those children. When a lot of those parents are working 2 jobs, they're going to have legitimate problems choosing work or educating their children. And I don't think that's fair. I think as a school system, we can do better. I think we can offer them face-to-face or virtual, whatever they choose. And I'm not sure, we've heard this whole presentation that has been skewed to reasons why we should close, and we've heard no information about why we shouldn't close or how we can open. And to me, that's the issue, because we have people that are coming in here and we're saying, you know, we can't do this, we can't do this. I understand it's Dr. Burns has done, or administration has put on this to convince us to do Plan C. But it would have been helpful if you would have also had some of the reasons why we can open and why we could do Plan B, not 9 weeks in the future, but what we could do now to prepare. And I didn't hear a lot about that. I'm disappointed that parents really weren't involved in the process. I know Ms. Eastep pointed out a principal had some kids, a lot of our teachers have kids, but they're involved in the school system. You want parents who are not involved in the school system to come in the process, because I think they bring a pretty unique perspective. I'm disappointed they were also not involved in the process. So obviously, most of y'all have already made up your minds as to this Plan C, and y'all are likely going to vote for Plan C. But I just can't in good conscience. I can't tell a family what they should do. We're supposed to be listening to the community and give them choices. And that's what I think we should do.
Okay, and I'm gonna come in behind David, and I was looking at if we were closed for 9 weeks, 6 of the weeks would be off. The parents would have to figure out some way to take care of the kids for 6 weeks. I had one lady that sent me an email that told me that kids, I don't know how to say this, but she said that the ratio of kids dying to adults was not anywhere as great. And I'm wondering, you know, what's your threshold? How many of them have to die? Not that they're going to, but I don't even want to talk about that. That really bothers me.
Nobody should die.
But Bill,
No, nobody should. And I'm not
That's
saying that
crazy
we're
that you
going
didn't-
to make anybody die.
Oh, I
I'm just
know you don't,
saying
Bill. I know you don't.
But
that
Bill,
the
also
fact that-
keeping these kids home, you know, domestic violence is going up.
I am very aware of that.
There are other things that we were not presented with today. We were skewed on one thing about COVID. There are a lot of things that kids are going through, whether it be education, whether it be domestic violence, whether it be not getting those that they should be getting, whether it be not being around their friends in a safe environment. We weren't told about any of that stuff today. All we were told about is the reason to close school. It's a balance.
Well, they're not closing it, they're delaying it. And it's, when you see
We're not
71 new cases since yesterday. I've been watching these numbers for months, and this is very scary. If the health department came up and said 12 point something is the ratio, which is, and it goes up and down between about 7 and now the high is 12. This is a huge concern. I'm concerned about all the adults in the building, all the kids' families. This is death. We're talking life and death here.
The governor came out, that's not what the governor said, but the governor actually came out today and said we were actually plateauing or seeing a decrease in cases. Now, I know it's easy to say, oh, let's discount that because that doesn't
I'm not discounting. I think it's good.
That's actually what the governor said today. We're 3.5 weeks from starting school, which would be on 8/17. Today, the governor came out and they asked specifically about about what they were going to do with schools. Why wouldn't he just close all schools? He gave a very clear answer that he was not going to close all schools and that it was up to different places because people learn differently. It was very clear what he said.
No, it's because different parts of the state have different numbers. Some places are great. We're not great. We're looking pretty bad. That's what I was just bringing up.
Mr.
Dr.
Whitman,
Brown.
let me address something real quick.
I would just like to say that I'm going to vote for the closing it, for Plan C, but I don't want to stay closed for 9 weeks. I do not want to do that. I want to get things fixed, and I want the administration and anything I can do to help them, I will. But I want to get I want to get the kids back in school before 9 weeks. That's all I gotta say. And I know there's a lot of folks that are feeling a lot of pain from what we're doing. And I am so sorry. I am so sorry because I understand what you're going through, but I got to look at the whole county and figure out what's the best for the entire county and get the system back up as quick as we can.
Dr. Burns,
Yes, ma'am.
has there been any consideration for our maybe K through 6th grade students or parents who want them in school, that when we do have the opportunity, that we can start at least with our younger children and get them in school?
That would be a decision the board can make at that time.
Because those are the ones that are having such a difficult time at home and trying to keep up. And they cannot lose time. They really cannot. This is a major concern for a lot of parents, but I realize the presentation tonight, and I realize maybe the need to go to Plan C, but I think we need to consider other options and see how many children we can get in our schools.
Jeanette, I think we could work our way into it.
I think we
But
can.
we need to get the teachers back in their classrooms, teaching virtual, getting their classrooms ready. And as the numbers go down, we can start sending the kids back to school.
And
I agree with you 100%.
I agree with you, Bill, and I want to add to that. This is not just about the school system. This is about our community. It's about wearing masks. It's about social distancing, because every single one of us wants our kids back in school. No one will disagree with that. We know that that's what's best for them, and we know that our teachers want them back in school. But at the end of the day, it's not just about the teachers in the building. It's not just about the students coming back. It's about all of us working together, doing what we need to slow the spread, and then we can get there. But we're not there yet, and we have to err on the side of public safety and health right now. I support Plan C. But I agree with you that I'd like to see the sooner we can get there, the better off we are.
Right, and that's what they have said repeatedly, is that it's better to do it now and then we can open up than try to go back and forth and back and forth. These kids, these are children, and we need to be as consistent and child-friendly in a sense, and that would be the most rational way to do this. And I agree with you, Bill. You know, I think we all do. We want the kids back there as soon as possible.
But we need to get the teachers back in the classroom, get the rooms ready, and get the kids back in there a little bit at a time. We've got to get the kids back in the classroom.
I don't think anybody's disagreeing with that.
Well,
All
It's a
right,
matter
board
of
members,
running safely.
board members, I'm going to call the question. Ms. Bowie, would you please call the roll?
Miss Eastep,
Aye, yes.
Mr. Wortman,
Absolutely not.
Miss Adams,
Aye.
Mr. Boyer,
Aye.
Miss Justice,
Aye.
Miss Nichols,
Yes, with an attempt to get our children back as soon as possible.
and Mr. Rivenbark.
exactly what Ms. Nichols just said.
Madam Chair, the vote was 6-1.
Thank you, Ms. Bowie.
But I want to make sure that wasn't just a vote. I want to make sure, and I'm not putting this off on the administration. I want to help them in anything we can do. I want to get the school open back up as soon as possible. And that's all I gotta say.
Mr. Rivenbark, I will echo that sentiment, and I will say that what I heard tonight was a lot of positives about how far they've moved down Plan B, not just the barriers.
Right.
I agree. I think they presented a compelling case that shared all of the good things that they've done that reflects the work that's been going on for months. And I appreciate all of that, and we need to continue to keep working on it.
And we got somebody coming in Friday afternoon or Thursday that's going to help us get a
Mr.
little bit
Rivenbark,
further.
we need to, Mr. Rivenbark, let's talk about that later. At this
Can I add
time,
this
I
too?
will entertain a
Can I say
motion to
this?
adjourn.
Move for
Well,
adjournment, Mr.
I'd like
Boyer.
to make one statement.
All right,
I think all the teachers agree that they too want to get the kids back in the classroom safely as soon as possible.
Mr. Boyer made the motion to adjourn. Is there a second?
Second.
Who made the second?
Miss
Bill
Eastep,
Rivenbark, second.
Yes, ma'am.
I was just
All
doing
right,
the
Mr.
count.
Rivenbark made the second. Aye.
Mr. Wortman, Miss Adams,
Aye.
Mr. Boyer,
Aye.
Miss Justice,
Aye.
Miss Nichols,
Aye.
Mr. Rivenbark.
Aye.
Thank you.
Thank you, Ms. Bowie. This meeting is adjourned.